Hey, everybody. Welcome back to the In Good Hands interviews. I'm Karen here with the great Ashley Giles, who she and I have a little bit of a history, and I love that. I've known her for a few years now, and I've known her through a few medical education companies, and I'm so excited to be introducing her for the first time to the world. I feel very honored to be the first one interviewing you, and I feel like this is not going to be the last, as it's she's done some tremendous things since I've known her, and I do have her bio with me. And I do want to preface this by saying, like, she's like a closet badass. Like, she's one of those people that has just done things without the spotlight, and she has graciously allowed us to look in and take a little peek into what she's doing in her practice and a little bit of how she's doing it, which is so incredibly important. First, I'm going to read her bio. Ashley Giles is the co-founder of the Origin Medical Clinic. She's an APRN, and also, in addition to her Master's of Nursing, Ashley has completed 2 fellowships through the A4M and advanced training through the SSRP, advanced training in neuroendocrinology through Millennium Health Network. She also runs her own private practice specializing in neurologic recovery with a focus on special forces veterans. And as a wifey to a veteran myself, this holds a special place in my heart. So Ashley, my goodness, like, you've done so much. I don't think your bio does you any justice, by the way. So I'd kind of love to hear from you how you got started, and then the little bit of how you ended up opening your own clinic.
Yeah, thank you. So happy to be here and so thankful for you guys and your team. And I guess I ended up I actually went to school for architecture and graduated and worked in the field. And as I was going through that program, I realized through the end of that I wanted to do something in medicine just because of my own health problems. And ended up just deciding to take it out and start working and then paid my way back through school to go back to be a nurse practitioner. Always kind of thinking that I wanted to be more of a functional alternative um, type of practitioner, but at the time also frustrated because I felt like there was a wide range of that and some of it wasn't as science based as other forms of it. And so wanting to figure out how to do that in a way that was very like scientific and science based. And so graduated with my NP and started working in family practice and then was able to start working with a functional medicine practice. And through just continued training, got a huge interest in cognitive recovery, um, partially just because of my own history and my family's medical history, but also because I found that that was one of the biggest gaps of care in conventional medicine. And so a lot of people were seeking out alternative health to get solutions in that area. And so we had a personal family friend who is a special forces veteran and was really struggling. And he had just had a hip replacement. He was having marital issues. He was depressed and anxious. And he started working with us. And, he had, because of his status in the military, had really been all over and started, he just was pessimistic that we could help. And in 3 months, he was sleeping. His depression was better. His marriage was better. After 6 months, he actually ended up doing a competitive bike race and really just had a 180 in his recovery. And he is like a huge advocate also for his community. And so he just said, I really don't feel like there's anything out here for guys like us. And even with the facilities that he had been to. And so he just approached us and said, um, we want to create something to be able to reach this community, but we feel like we want to do it in a very specific way. And would you be willing to work with us? And my husband is in construction and very successful at what he was doing, but traveling. And we just said, this is terrifying to think about, but ultimately we said like we have this opportunity to do some good in this area, and in 10 years we would regret it if we didn't try. And so we decided to try.
Wow, try again, the biggest understatement to try to open up a clinic. It is no easy feat. Anyone who's done it and is doing it now and is doing it well, it's with a massive uphill battle. But before we get into that, I love this story of it starts with one person and that built this entire system that you've done. What did you start your loved one off with? Like you know, you said 3 to 6 months. You know, you started him on certain things. Like what did that look like?
Yeah, so I mean, basically with all of our patients, it just goes back to like what is their body missing that it needs to use to effectively repair. And the body is so amazing, and we found that consistently over and over again. If we're putting the right repair signaling in place, along with the right building blocks, which is like that raw substrate of the nutrition, the plasmalogens are a huge piece of that. It's like the construction crew and the materials, and the body innately knows how to put that together to get back to a state of homeostasis, and it can do it way better than we can. And so, yeah, we through lab testing, we supported hormones, but the plasmalogens were such a huge part of that because that in most of these neurologic recovery cases, it's the rate limiting factor because you're missing that raw substrate and anti-inflammatory signal for these guys to be able to get ahead of that recovery. And specifically with that veteran community, toxicity is such a huge issue. And plasmalogens not only help with the neurologic recovery, but they provide this protection whenever these guys had such, high toxic exposure. So yeah, I mean, it takes a lot of patient participation on their part, but we've just seen it work over and over again.
Wow. So did you see that kind of toxic exposure when you're doing those labs? Like, what did you look for? How did you find that out?
So we do use specialty testing, and with a lot of our military guys, especially special forces, we can assume that there's a significant toxic burden, and so uh, a lot of times they'll use that testing to make treatment decisions. So we may not test for all of it, but we'll use that test to specifically look at is there anything currently that we need to adjust environmentally to make sure that there's no longer exposure. And so Vibrant has great panels for that. My Mecca lab has great panels. But a lot of these cases, it's like that history is there and known, and we need to account for it as part of that recovery.
Wow, what a great story. And then I love how you mentioned that the marriage got better after you just fixed biochemically what's happening in that foundational kind of setting, which and then it leads me back to like how you came from architecture and your husband is in construction, and then you're just kind of working this up as you are still an architect. You're like an architect on NP. It's like that's what I'm kind of seeing about you, and few minutes of speaking with you, you're looking at it very functionally. It's kind of really cool to see it that way. uh,
Thank you.
yeah, so okay, getting back to some of your specialties, I'd love to hear about that more. You know, you mentioned that you're serving this underserved demographic, this special forces veteran, but I'd love to know some of the other specialties that you have in your practice.
Yeah, so all of our client bases has been just word of mouth, and because of that, we do see weight loss patients, we do see hormone patients, but we see a lot of neurologic recovery, and so we've ended up working with a lot of kids who have been put on multiple antipsychotics and antidepressants and amphetamines, where there's a lot of polypharmacy, and been very successful at helping them get off of those medications and function, in a work environment and in a school environment. Um, and the other piece of that is mental health, bipolar, and then Alzheimer's and dementia. And so I think once you treat one person in that community, the word gets out. But I also just feel like this area of medicine, not only is it underserved, but it has a stigma around it. Over and over again, I think what I've seen is that people attribute some of the neurologic malfunction as character attributes. And they'll say, well, this is just, this is who I am, or this is the type of person I am, or this is just me. And it's the really fun part is to be able to show them that the brain can malfunction just like the heart and the kidney and the liver, and it needs to be supported accordingly. And so one of our major goals with our patients is to help them understand that um, they're going to get to know themselves for the first time as we start to have that operating system work better for them.
Wow. So that's probably the coolest piece, like, just changing maybe even seeing someone's actual personality come to life once you start fixing that brain. Can you think of any specific stories that happened, like, with that transformation, like, getting to know your real you? That's it's so beautiful.
Yeah, I mean, there was a boy who started with us. He was 14 at the time, and he was on 3 antipsychotics and amphetamine and incidentally, and just slowly working him through that process of being able to come off the medications. And in all of those cases, I mean, really any neurologic patient that we have, the plasmalogen piece is foundational because it's the element that allows us to stabilize the neurochemistry of the brain to allow us to challenge the brain in some way, like including a medication wean. And so I explained the plasmalogens, the glia, like a fire hose to the brain, but it's also providing some structural stability so that when we introduce that stressor, they don't crash and they're ready for it. And so usually what I tell people is like, let's get you in and get your brain some support. And then you tell me when you're ready to start coming down on this. So this kid, it was so neat because, he's 14, so he would come in and be shy and not really talk to me as much. But his mom was just saying like, he used to be in his room and door closed all the time. And now he's downstairs, he's playing cards with us. He wants to go on vacations. He wants to spend time with us on the weekends. So that was just so heartwarming to hear because they hadn't been able to take a family vacation in over 10 years because of his, just how much he had struggled.
Oh my gosh. So he was almost like a had some hermit tendencies.
Yeah, and
Oh
just
my gosh.
I think shame and frustration, I think he couldn't control himself around other people and that the alternative for him was to be by himself.
Oh,
So these things are very isolating for patients.
oh my goodness. Like, that's life-changing. Like, he can go to college now and be perfectly fine in social settings. I mean, that's beautiful. How old is he today? How long have you been treating him?
He's 16, so
Oh my gosh.
so that's a whole new challenge, but, yeah, I feel, his mom and I both feel confident that now he's got the skill set that he needs, and he still has to make hard decisions, like, he inherited a body where he's held accountable much more than other people with his lifestyle decisions, and, but he's been able to see what it looks like when he does do that, which is, it's a tool
Mhm.
that he didn't have before.
Oh, that's beautiful. So how is it that you first even heard or even got interested in plasmalogens? Because it is so obscure. People have always come up to me, especially like doctors who are just meeting, Dr. Goodnow for the first time. They're always like, "Where has plasmalogens been? Why am I just hearing about it now?" So when was that point for you? And then what kept you on this plasmalogen, path?
Yeah, so, I guess back in I'm trying to remember the year, 2021 maybe, Dr. Goodnow did a talk at an SSRP conference, and it really struck me, the science behind it, and after that, I'd actually read his book, Breaking Alzheimer's, on the way to the conference, and so, whenever he spoke, there were things that I had learned through the Millennium Health, concussion recovery training that the foundational pieces and pathways, we had a missing link in the cog in the link where it was just we were doing so much from a signaling perspective, but we were missing some of that basic substrate that helped with some of the ability to regenerate. And whenever he talked about plasmalogens, it was just like this aha moment, like this is what that rate limiting factor has been for this process. And so initially, mainly looking at it for concussion recovery. And then since, just understanding more about plasmalogen's role in the body, even, generally with the heart and the lungs and the blood vessels, that was very much during COVID. And so all of these conditions of high oxidative stress, including COVID, including mold toxicity, including just day-to-day aging processes, just looking at the mechanisms of what we're treating, right? Like, what are the pathways that are going awry here, and what are the building blocks and the signaling that we need to right the system? And almost every case, I would say it's extremely rare for us not to have a patient that is not on plasmalogens. In most of these cases, like it's a core element that allows the body to start to get ahead of what it's trying to repair.
That's fantastic. You can so you're already like into this plasmalogen research. So you read the book before you even met him. That's pretty remarkable. It's very rare. It's usually the other way around. Like they meet him and then they read the book. So that's fantastic. Really great to hear. So there's been like a hesitancy that I've been noticing amongst a few of the practitioners that we meet with, where it's like, oh gosh, like how do I pivot towards this new thing, that this unknown path? Like how do I do that? And what convinced you that this is how we go? Because it is so against the grain to do something that is unknown. So what about plasmologist made you go like, yep, this is how we're gonna do it, and I'm going.
Yeah. Well, I think part of the misconception with functional medicine is that it's not science-based. And I think there's a difference between evidence-based research and trials of hundreds of thousands of people, um, in that N of one where we're looking at pathways and that patient's trying something. But everything that, we're doing in cellular medicine, and I know all of my colleagues are doing as well, is where it's a very scientific approach. And if you understand the pathways and if you understand the body, what I'm looking for as a provider is like, how can I affect this pathway that we can see going awry in the safest, most accessible way possible? And before plasmalogens, we were touching those other things, and a lot of times we were working around the fact that we didn't have plasmalogens. And I do think that the body is resilient and sometimes you cover, 7 of its 10 needs and it can figure out the rest. But it was really obvious that, as I was working on neurologic inflammation, plasmalogen glia not only does that, but it works as a building block, as a substrate for the brain being able to regain that volume and support the white matter. And so very early on, it was like, not only is this a better treatment for the other thing that I was using, but it's covering more things. And so it almost, I feel like it's not a gamble at all. It's not a leap of faith. It's like this was a very clear path when you look at the science of the research of plasmalogens and the work that Dr. Goodnow's done to validate his product. But also just like we were using these other things and now there's a better way to do what we were doing before.
It's not even, it wasn't even a choice. But like, this is what I'm doing. That's very cool. So what other things have you paired with your plasmalogens? Like how are you optimizing a patient in other ways with other tools?
Yeah, so with concussion recovery, right out of the gate, we want to do lab work and get that work up to understand what's going on from a chemistry perspective. But one of the really nice parts about using plasmalogens is the safety profile is so great and the tolerability is so high that, right out of the gate, I'm very comfortable saying like, let's start you on this product immediately, usually plasmalogen glia. And then we'll pair that with high dose ketone esters. And so without, doing any testing, we can immediately support the mitochondrial system and that energy substrate and that inflammatory cascade. And so, usually what we see is, especially with, early concussion recovery, people immediately feel better. They immediately sleep better. They immediately get some of that cognitive reserve back. And so that really paves the way for us because when we meet again and we're going through the lab work and building on that protocol, they've seen enough improvement to where they're ready to go and kind of all engines forward.
Wow.
Um, so that's a big piece of it. I would say cardiovascular health, anything that we're doing with the cardiovascular system, they're a huge tool. And again, thinking about the signaling and the substrate at the same time. Um, Post-COVID recovery, it's been an essential tool. We've seen pairing the plasmalogens again with the ketones. I think they're a really nice pair for that kind of like initial rescue for a lot of people. We've seen neuropathy and nerve pain post-COVID improve. We've seen acute COVID anxiety improve. We've seen tachycardia and autonomic dysfunction improve.
Oh wow.
So just, and then in those cases of mycotoxins, a lot of times we'll use a detox protocol along with that plasmalogen, and then the choline or the PC plus. And it's really like it's protecting them during that detox, but it's also, how do we get that cellular resilience back by really rebuilding the system from the inside out? And the plasmalogens are such a huge piece of that process.
Mm, that's phenomenal to hear. Wow, you found like this combination. I feel like I need to start taking my ketones in the morning with my neuro. I'm going to start doing that. See what happens. Were there any sort of results that you've been seeing that kind of like surprised you? Like, does a case kind of come to mind for that?
Yeah, there's a case we had a guy who was referred to us. He's a veteran, and he through our veteran community called our office, and he had had three concussions back to back at least, probably a- more weren't fully classified as concussions, but he had had difficulty sleeping like 2 hours a night and regular vomiting for about 6 weeks at that point. So basically just severe neurologic inflammation. And then also just, he had a very dramatic gut shift as well, where his body just was not like digesting food, partially because of that stress response.
Oh, wow.
So he actually, through his workup with neurology, they determined that he had had a brain bleed as part of that initial concussive injury. And it was stable, but at some point they were going to need to go in and do a procedure to kind of clean up that dried blood and make sure that it wasn't going to cause any further issues for him. And he stabilized very quickly on plasmalogens, ketones, mitochondrial support, peptides, and then we had been working with him, I would say 4 or 5 months, and he went back. They actually, he went into the procedure, so that there wasn't really a reason for them to re-image him because that is not necessarily something that resolves on its own. And when they went in to do the repair, it was already resolved. Like his brain had done that work itself. And so his neurologist just asked him what else are you doing? And you know, we were the only other thing that he was doing. And so um we don't really have another explanation for that, but the neurologist was shocked and he was shocked. And yeah, so just really I think it's just the tip of the iceberg. I think we're gonna learn so much more about what the brain's capable of.
Wow, that's incredible. You Did he have to go under at that point when they realized that he didn't have to, or was it after imaging?
He was under, yeah, there was
Oh.
image. Yeah. It's like they ended up and looked in there, and it was there was nothing to do, which was great, but
Goodness.
we had another guy who he actually is more of a recent start with us, but he's a Parkinson's patient. He's probably about 7 or 8 years into that process, and he had a DBS implant, where it's a implantable device that helps modulate the tremor from Parkinson's. So at one point, his tremor was so bad he couldn't take the food from his plate to his mouth, like it would just get across the room, right? And so this implant had really helped him. And unfortunately, it had affected his voice box, so it slurred his speech, but he was able to have motor control with the implant turned on, and they would adjust this periodically. And he was about 6 weeks into the plasmalogen therapy, and his DBS actually turned off, it malfunctioned, and they had no idea because his tremor didn't come back. And so, they went for a checkup and they realized it, and then they realized how much the plasmalogens was helping. So he's, um, all engines forward, but we're hoping if we can get that DBS totally turned off for him, that he'll get his speech back, and that will be, a huge benefit.
Wow. How do you not just, oh my gosh, dive in after seeing cases like that? That's incredible, Ashley. I mean,
So early into treatment. Yeah.
wow, that's amazing. May I ask the age of this Parkinson's patient?
Yeah, he was 65, so
It's not
relatively,
even young. Oh my gosh.
I mean, relatively, I guess, yeah, but
I was expecting like okay, someone with that Parkinson's. That I mean, it's normally in the older age groups, but that result in 6 months is pretty incredible for that age. Wow.
No, and he had that result in like 6 weeks to 2 months.
Oh, 6 weeks. Oh my goodness.
Even I was surprised, I couldn't believe it.
Oh, that's that's remarkable. May I ask, like, what, how much of the glia he was on?
So at that time, he was taking 8 glia and 8 neuro, and we had done some mitochondrial support, but he wasn't on that full protocol yet. And so it was really pretty light as far as the level of support compared to what he's doing now.
That's incredible. Now, do you have any other practitioners in your practice, or is it just you?
So we were so happy to just have hired Angie Thomas, who is a local nurse practitioner. And so she's been with us for a couple of months now, and she's been amazing. And she has such a heart for patients, and we're so happy to have her.
Oh, wow. Okay, so now it's not just you, it's you with another practitioner. This is I think the power of just doing really good work for people. Really quick on, like, just building the practice side. Like, there's all kinds of challenges in opening a brand new practice, but would you have any sort of words of wisdom, like things that you would say when people are diving into this potential opportunity that you've seen for yourself? Like, hey, what would you tell someone getting into this or thinking about opening up their own practice, other MPs wanting to get into what you're doing, finding their niche, and then growing out? Like, what would you say to them?
Yeah, I would just say, the first step is very small. And, I think with treating patients outside of conventional medicine, I think if you know the science and you can defend what you're doing and you can help the patient understand what they're doing, you just start with one patient and you're gonna get questions. And I think as long as you know that you can answer those questions and defend the fact that that risk benefit ratio, the first rule of medicine is do no harm. And that's what's been such an easy um, you know, transition into the plasmalogens is there's not concern for harm with that. And that is um different than a lot of even, conventional medicine tools. And so I would just say you want to understand it yourself, try it on yourself. And with the new practice, I mean, we really had no idea what we were doing, but we just said like every patient experience, we want it to be great, and we want them to feel supported, and we want to make sure that they know they have a partner in their health and recreate that patient provider relationship. And we've just been really blessed because I think once somebody knows that they have somebody who's caring for them and really cares and wants to provide them that support, they just talk about it. And it's just we haven't had to do anything other than just provide really good care, and then the rest has worked itself out.
Well, you make it sound so easy, but I've seen you at almost every, medical education event out there. And Ashley wasn't just eyes glassed over. You were engaged, you're asking questions, you're talking to the speakers after, you're listening to other people ask the questions to the speaker. And then, like, I saw you're like writing stuff down the entire time, typing your notes. It's you put in the work to learn this. And in order, I guess, to be able to do what you just advised, and that's to defend and ask questions, or answer the questions with the best possible answer. Like, you put in the work to be here. I can see that, Ashley. So it's not that easy, but all that.
Well, and that's the other piece is that education companies like you guys. I mean, we would not be able to do this without that resource. And I really feel like I'm standing on the shoulders of giants, including, Dr. Goodnow has been so integral. And I just feel so indebted to him for all the work that he's done for people because it's such an incredible thing to get to see people have those recoveries. And I really truly believe that most of that would not happen if we didn't have plasmalogens as a resource.
That's incredible to hear, Ashley. Well, and is there anything kind of exciting in your life that you kind of want to share? That any last bits that's going on that we can applaud you with?
I mean, I guess we have a 3-year plan to build a center that is allows our veterans who fly in to see us to have like a facility where they can do kind of like restorative treatments the whole time that they're with us. And we want people to be able to come in and leave feeling like a different person. And then also for our local patients to have access, as like a gym membership to that. So we're just looking forward to, it's so fun to get to partner with people with their health, especially when they're motivated to make the change. And so we feel excited
Oh
about
my gosh, that's wonderful. You have to share pictures when it goes live. We want to post about it and brag about it.
yeah. Yeah, we're
Oh, that's amazing. Oh, how exciting, Ashley. I love that. Okay, so I can already tell you serve the veteran community. You love that community. Any other patients that would be suitable to come to your practice?
Mhm. Yeah, I mean, we see a little bit of everything really. And like I said, we inherit a lot of neurologic recovery patients because we get into those communities with the first patient and then they talk and but we see weight loss, we see hormone replacement and in every case we're treating the whole body. And so we end up doing a little bit of that with everybody. And sometimes we see people who just want to function at a high level and perform at a high level and be able to do that and come home and be amazing for their families. And so I think every person is a candidate for just helping their body be optimized, and that's what we hope to do is just figure out, like for you specifically, what is the right thing that's gonna make the most difference.
Ah, that's beautiful. Well, folks, Ashley Giles, this will not be the last we hear from you. I'm sure you're an incredible practitioner. I can see the love that you have, not only for what you do, but the love that you're giving out to your patients. That's really, really beautiful to see. I love that, Ashley. Thank you so much.
Thank you so much.
All right. Well, we're hoping that we can hear more from Ashley later, especially when you launch that center. I can't wait to see it. And yeah, folks, this is Ashley Giles, Origin Medical Center in Illinois. No,
Georgetown, Indiana.
Indiana.
Middle of nowhere, yeah.
And all right, so that's where you're going to be able to find her, folks. She is a Prodrome Elite practitioner. We're so lucky to have practitioners like this. Hope you enjoyed this interview, folks.